Okay. Hello, welcome to the Political Science Club's hosting of the healthcare debate. I'm glad there's actually a bunch of people here, which makes me really happy that everyone's coming out to learn a little bit, give their perspectives and everything like that. I'm Christian Novia, I'm president of the Political Science Club. We are hosting this event and in cooperation with Students for Liberty, College Democrats, and College Republicans. We will be hosting this event based on the general topic of healthcare. It will not be specifically about Obamacare or Affordable Care Act, same thing. There will be questions involved about the Affordable Care Act, but we don't want it to be just the sole focus of this debate, and rather whatever alternatives or ideal forms of healthcare. But of course, we can't ignore the fact that this is a huge piece of legislation that's passed in recent history. So without further ado, I'd like our panelists to introduce themselves, starting with College Republicans.
Christian, thanks for inviting us. My name is Joe Hackett. I'm Vice Chairman of the College Republicans.
Hi, my name is Bill Hibbs. I'm the President of the College Republicans. I've been involved since my freshman year, and I'm really excited to be here for this debate.
Okay. Hi, I'm Tom Mandrakia. I would also like to thank the Political Science Club for setting this up. I'm the Vice President of Students for Liberty, and I am also very excited.
Hi, I'm Nick Giorgia. I'd like to thank the Political Science Club and all of you for coming out today. I'm President of Students for Liberty. I don't know if I said that right.
I'm Musab Bostapet. I'm with the College Democrats. They forced me to do this against my will, but here I am. I joined the College Democrats last semester, so I'm new to this and trying to get everything through. And thanks for everyone coming.
My name is Victoria Lane. As everybody said, thank you for having us. I'm a freshman here, so this is my first semester, and I'm a member of the College Democrats.
Okay, before we get started, I'd like to address the format we're doing. It's a kind of a hybrid of a town hall roundtable format. It's going to be pretty formal in the beginning. I'm going to ask a question. Each team has 5 minutes, a maximum of 5 minutes to respond. They don't need to use the 5 minutes to its entirety. Then as soon as each team gives their 5-minute response, we'll open it to a roundtable discussion. If that goes stale or if there isn't as much talking going on, I'm opening it to the audience. And if it starts getting a little bit out of hand up here, I will intervene and open it to the audience. And if there are no audience questions or there is no continuation of the roundtable discussion, I will ask another question. Before we get started, I'd like to ask everyone to silence their cell phones just so it doesn't show up on the camera, especially those close to the camera area. Other than that, thank you all for coming, and let's get started. Okay, I'm going to do it so that the College Republicans will answer first, followed by Students for Liberty, and then College Democrats. Then I will open it for the roundtable. The first question is a very general one, and it is, what is your ideal plan for reform in the U.S. healthcare system? This doesn't mean you have to get into very detailed specifics, but I want as much as you want to give on the topic. College Republicans?
Okay. Our plan for fixing our healthcare system is not involving the government as much as they are currently. We need more choice right now. Simply, there just aren't enough. A reason for that is we cannot sell, or insurance companies cannot sell across state lines. So there are currently 50 monopolies that have been created by the government from preventing insurance sales across state lines. What this does is each state has their own separate rules and regulations on what each plan has to cover. And in New Jersey, it's really high. You know, it can be up to like almost $6,000 for a healthy young individual for a year. But in Kentucky, where there aren't really near as many regulations, it's about $1,000. So that really is a big part of it, is just giving people more choice. You can't force someone to buy coverage just in their state. It's unfair. In addition to that, bringing down the cost would be medical tort reform. Currently, people are suing doctors for every little thing, and we need to punish overzealous lawyers, and we need tort reform to really bring down the overall cost of healthcare. We believe that all of these, the combination of all of these important reforms, it will truly bring down the cost of healthcare, and will make America a healthier place to live.
And to go off of that, we as Republicans believe the current system has 4 reform measures. One is promoting competition between the insurance companies and the pharmaceutical industry, reforming the Medicare payment system, establishing clear standards of care, which is important, later on we'll get to that, and ending the lottery court system by capping the damages awarded by the judges.
Okay, thank you very much. Our plan is actually a bit similar to the College Republicans. So, first of all, we all agree that we want all Americans to have affordable health care, quality health care at a very low cost. We all agree on that. That's important. But the problem with U.S. healthcare today is that it is simply too expensive. As a result, a lot of Americans cannot afford quality health care. So, naturally, a lot of politicians, a lot of Americans have looked at European systems. They see them getting comparable results. They see them being cheaper. We currently spend 18% of GDP on healthcare. European systems spend between 9 and 11. And they'll say naturally, wow, same quality healthcare, lower cost, it's a no-brainer. However, there's many, many problems with these systems, which we will get into. And additionally, when applying those systems to the US, it misses on some very important questions. First of all, why is US healthcare so expensive? That's a very important question we need to ask. Secondly, would simply giving free government health insurance to all Americans answer that question of cost? The answer is no. There's a lot of other things you have to do to make healthcare cheaper. Secondly, is it a good idea to bring millions more patients into the healthcare system without adding any doctors? The answer to that is also no. You have to figure out a way to increase the number of doctors. The U.S. currently has one of the lowest doctor-to-patient ratios in the entire developed world. So when we actually looked into the question of why healthcare is so expensive, the answer was undeniably clear, and not surprising either. It's the government. The government is the reason that healthcare is so expensive. The monopoly that the American Medical Association has over doctors greatly limits the number of doctors. This makes healthcare much more expensive with less suppliers of medical services. The FDA regulations actually account for 85% of pharmaceutical costs. This is a tremendous cost that can easily be reformed with the repeal of one amendment. Health insurance company regulations, as the college Republicans mentioned, you can only buy health insurance in your particular state. This increases the cost. Misguided tax codes, which create an employer-based system, also makes healthcare very expensive. We can get into detail on all these regulations, don't worry. But the main problem with the government-run system is when the government messes up, everybody loses. There's a big problem with that. When you have a market, there's choices, there's privatized losses. And so, a lot of people will answer, you know, all of that might make sense, but we believe healthcare is necessary. Healthcare is a right, and therefore the government should provide it. We'd simply like to say there's lots of things you can argue that are rights that are necessary, such as food, clothing, housing. Very few people are proposing a government monopoly on food, clothing, or housing. Why? Because there's markets in these. There's less government regulation, which makes these things very cheap and widely available. It's very possible that we can simply have the government's role as being helping the very poor and those with pre-existing conditions, as opposed to trying to monopolize the entire industry, which always leads to less innovation, long waiting lines of a whole bevy of problems we'll get into. Thank you.
Right, so as has already been discussed, there is a major problem with the American health system. Costs are going through the roof. Our quality of care is not as good as other nations, and we've seen other nations come up with a better solution than what we have right now. And our solution to that would be to model a better system based on other nations, see what they've done correctly, and put it onto ours. And our plan would involve a single-payer health system. This would not be socialized medicine. So the government would not run hospitals, and doctors and nurses, they would not be government employees. What we would have instead is socialized insurance, so that the government covers the cost of everyone's insurance. What we have right now is a free market that has completely run amok. Something like 30% of all the costs of an insurance company, health insurance company, is overhead. So that's profits. That's marketing, that's advertising. Under a government-run system, you would not have these costs anymore. They would be only government's sole responsibility would be to take care of its citizens. And there are three major reasons why costs are so high right now in the United States. And the first of that is the fact that hospitals and doctors, they can charge whatever they want as they like, and many times you don't know about the cost of these procedures and these devices until after you've been taken care of. Under a government-run system, what we would have is the government giving contracts to corporations and companies that are able to give a quality product at a lower price. And since the government is buying it in bulk, it would be a lot more affordable and a lot cheaper. This is economies of scale, so essentially the Costco effect or the Walmart effect. When you buy things in bulk, it's a lot cheaper. Number two, we spend a lot more on administration. So as I mentioned, the 30% that is spent on overhead and CEO pays are going through the roof. You can completely remove most of that. Three, we pay higher services than they do. So again, we'd have to identify which ones would be more affordable under our system.
Essentially, with what we're saying is also, our current system is modeled after the free markets, so our prices are double or triple that of other countries, other advanced countries at that. And what we really want to do is bring our costs down so that we can see that we actually have the same benefits. These other countries are paying less, and they have much higher life expectancy rates than we do here. And we really want to model a system that really promotes life over business. Right now, insurance companies and hospitals, it's not really about life. When you go to a hospital, you're trying to take care of yourself so that you can continue living. It's not about profits. We basically want to make the healthcare system into something that makes you not a number and a person.
I'll open it for roundtable. Anybody have a particular beef with one of the other plans? Yeah, sorry.
I guess I'll start. Friends of the Democratic side, they mentioned that there would be no 30% overhead, or the CEOs would be taking home all those, those high excessive salaries. But what he doesn't mention is the probably 50% weights that the government will put with that. There has not been one example of a government function that has been done more efficiently than the private sector. And I, can't believe that Medicare will be any different.
If the private sector is doing so well, why is our healthcare system such a mess in the country right now?
Because of the government regulations on preventing a sale across state lines.
But if you look at how other nations, they've modeled their example, Canada and the UK. In the UK, they only pay 3% in overhead in total, what you call waste. Their overhead, their administration only costs them 3% of total spending. In Canada, it's only 1%. So if they can find a way, we can definitely make that work too.
Overhead does not denote inefficiency. In fact, higher overhead denotes more efficiency because you're spending more to make something more efficient. Secondly, you keep claiming we have a free market system, which is absolutely not true. A free market, by definition, is a marketplace free of force and coercion. Therefore, the bevy of government regulations.
Would you consider our system? Would you consider our system to be a capitalist system?
It is capitalist. There is private ownership of the means of production in many cases. However, it's also a mixed system. The many regulations we mentioned automatically make it not a free market system. It's a mixed system. We're not arguing in favor of the current system by any means. We want to greatly reduce the role of government, so it is a more free market system, which would greatly reduce the cost. We can get into that in detail at any point.
Would you say that our system is more free than, say, the single-payer systems in Britain and in France and Canada? And
I think it would be difficult to compare the systems in England and France and Canada. I mean, they're relatively similar, yes, but the results are completely different. I mean, in Canada, you could be waiting anywhere from a week to a month just to get an MRI, just to identify the problem you're getting. And then after that, you could be on a waiting list for 6 months for surgery. Whereas France, yes, it is very productive, and you're very quick to get care. But I mean, it's just a system that has proven to not work more often than proven.
You brought up rationing, essentially. Many people argue that in the single-payer system, you would see rationing of healthcare. But in fact, what we have right now is a grotesque amount of rationing. If you can afford healthcare, you can get it. But if you don't, like the 50 million who cannot, they do not have access. And you mentioned Canada. It's brought up often that people waiting months and months for surgery. Rationing, waiting lines were bad in the early 2000s. But if you look at recent numbers, they've gotten a lot better at that. So again, they've identified a problem, they went back and worked at it.
Okay.
So what you agreed then is that a government running a healthcare system does not eliminate rationing because we have scarcity of resources. Rather, the government decides who does the rationing instead of a marketplace. What we're arguing in favor of is a system in which reducing government's role would greatly reduce the cost of healthcare to the point where very, very few Americans, a very small percentage, would actually be rationed out of that market. And for those very few Americans left, the government can give assistance to them. Secondly, you also said that the European countries have better health outcomes. What did you mean by that?
Life expectancies, you can show in quantifiable data that they are living longer, they're healthier as a nation. I actually have a question for you guys. You talk a lot about the free market, correct, and how that's what we should be going towards. Do you have any example of a country that has quantifiable data where they are living healthier lives, there's better outcomes? Is there any example or model that we can look to with this, or is it purely theoretical?
Can I first address the life expectancy and such, and then I'll answer that. Firstly, the U.S. Life expectancy is not a good indicator of the healthcare system because there's so many things that go into life expectancy. The U.S. very unfortunately kills people a lot more with violence and cars.
1 minute.
Absolutely.
1 minute round.
We could use the example, I mean, if you want to bring up life expectancy, I think, let's just say like Mormons have a higher life
The same
expectancy.
things go on in the UK and especially in European countries. They have the same diseases that we have, they see the same violence. There's not
significantly less.
But a study from the University of Iowa took out fatal accidents from the equation. The U.S. had the highest life expectancy. Infant mortality rates as well. When you compare it to
Actually,
the
infant mortality rates in a city such as Detroit is a lot less than cities such as El Salvador. So we're not really leading the
Okay,
world.
that's
And
fine.
quickly
Life
on
expectancy.
rationing. I think the important thing is that if you fund a single payer system, you will get better outcomes. If there is rationing, if you spend more, and if you make it work, you won't see rationing.
The data shows that the U.S. has a higher life expectancy when you take out the fatal accidents, which is unrelated to healthcare, and a complex
Sorry to
study.
cut you off.
Okay, that's fine. Yeah, we'll mention it.
I'm gonna be a stickler about time. As riveting I started again, I'd like to open it for any questions from the audience. Yes.
A few years ago, my family and I decided to take a trip to England to celebrate our 25th anniversary. And I knew that someone in my office was from the UK. So I contacted her and I said, look, what if we have a health problem? Are the government-run hospitals in the UK reliable? She said, if you can afford it, be sure to go to a private one. And that was right from someone who came from England. What would you say about that?
Was that in correlation because you were a U.S. citizen, or did it have to do with her, would she have the same opinion for herself?
It was just based upon her experience of government-run hospitals in UK versus private hospitals in the UK.
Well, I mean, I have my own experience too. When I went to Turkey, a nation which spends significantly less on healthcare than us, I had a cold, so I went to a government-run clinic. There was no waiting line. I walked in, the doctor took care of me very well. Beautiful facilities, modern. She wrote me out a prescription. I went right next door to a pharmacy, and I was given medication I needed. Completely paid for by the government. I didn't spend a dime of my own money. I found very good service. I think if we go by anecdotal experiences, we can find different outcomes and different results, but I think ultimately the single payer system will find a way to treat much more people in a much more effective way and would see universal health care.
I remember a sheikh in the last year had a serious health problem from the Middle East. And instead of his going to Turkey, I recall he came to the US.
Right, because the sheikh has the money. You know, essentially, if you have the money in this country, you can get fantastic health care. And
You
again,
didn't think it
we
was because of
spend
better
so much
care?
money on health care that we should be able to distribute that a lot more evenly so that everyone can have a chance.
So you
know,
think it was money and not because he thought it was better care?
No, no one doubts that. We have the access to incredible care in this country, but the problem is that there's a lack of availability. We are rationing that care to only select people who can afford it.
There's a lot of
Well, I'm gonna limit the questions just so you don't get a roll, but I'll take a couple more. Who had their hand up? There.
All right. I had a question in regards to eliminating the state monopolies that the Republicans were talking about. Why hasn't the Democratic Party ever expressed any interest in eliminating those monopolies? The Democrats always say they're fighting for the little man, and eliminating monopolies, wouldn't that be a win for the little man?
There has has been numerous cases where the Democratic Party has advocated for the monopolies to go. A lot of the problem with that, and it seems to be a later question in the debate, has to do more with medical lobbying and companies. There's 4 times as many medical lobbyists as there are congressional people. It has more to do with other factors.
Take one more question.
You said that like the whole money and like coming here for thing. If someone's willing to pay the money for American healthcare, wouldn't that be like if someone's willing to pay like the most amount of money to have the best healthcare, shouldn't they deserve the best healthcare?
Yeah, but it's more of the issue whereas if people can't pay for it. It's not for the people, we're not necessarily arguing that it's the availability. It's that we need to spread it so that everybody has the access.
Like I said, it's available for the people who can afford it, and there's nothing wrong with that, but we want to be able to spread it and allow everyone to afford it, and we can do that in this country. That's why we can afford it. Right now, we are paying for universal health
How
in
is
this
having
country,
everyone
but
having
because
the same healthcare help them? If they can make the money to spend more on their own health, how is that fair to them that they're stuck waiting?
Because it's not fair to everybody else. You're thinking of one person, but we're really thinking of like America as a society.
again, the free market will ensure that those that have money will find health care, but it will not ensure that we have a healthy society as a whole.
Speaking of that, I'd like to move on to another question. Lobbying is a huge issue, and I believe someone brought up the question. Given the ideal kind of circumstances you guys propose, what is your belief, and what effects do medicinal lobbyists have on healthcare legislation, and what future is there with these lobbyists? I'll start over here.
Sure. Lobbyists play a big factor not only in the healthcare industry, but all the issues across the board. I think it's dependent upon that certain legislature, how he wants to handle that situation. But, of course, depending on what plan is offered, or, how that lobbyist, it's all individual. It's up to that legislature. You can't, it's not saying that my constituency said this, or my constituency, whatever that, it's in the hands of that legislature. So I think the question's a little off, but in the future, if I were planning this and making sure every lobbyist did the right thing, I think you need to focus on the idea of, and to go on this whole thing, everyone thinks, oh, we have the ability to pay for it. We have the ability to, we have the money, we have it. Well, what's we? Because the only way I see it is if we raise taxes, that's the way we're getting the money, okay? Or if we cut a lot of things, okay? Either, not really good looking from either angle. But in regards to the question, I think I try to limit that if it was in my control, the lobbying, because it severely can affect it. As a matter of fact, we've seen it. President Obama met with lobbyists in 2009 in Detroit, and over the issues. So.
Okay, well, I'm no expert on medical lobbyists. All I know is that lobbyists exist because the government is heavily involved in something, or they're trying to get the government heavily involved. You take the government out of the equation mostly, the lobbyists will disappear because they have no incentive. That's all I have to say on that.
I mean, they're going to spend their money to get what they want, and they know if they have such a large investment in the government, and the government will get them what they want, they're going to spend their money that way. That goes with, huge overheads. I mean, if you could say like they're blowing all their money on trying to lobby the government because the government is getting a bigger involvement in this industry, which should be more privatized in the first place.
I think the lobbying issue, you see what happens when moneyed interests are able to take care of themselves at the expense of everyone else. So in 2000, when the Affordable Care Act was argued, the idea of a single payer system was totally crushed after the health insurance companies spent over $600 million to stop it. And they've continued to spend millions since to make sure that we don't have a single payer system. Because that would hurt the CEOs and all the stockholders who are invested in these companies. And if we simply took them out of the equation, instead of them profiting, society as a whole would profit.
Go ahead. I had a question for the Republican. You said that, I guess if you had the power or whatever, you could control lobbying, I guess their voice. How would you, do you mean by legislatively limiting their ability to lobby for
specific revisions on healthcare reform?
Yeah, that's the one thing Republicans, of course we need regulation in order to maintain control in the country, but not excessive amounts. And I think that is the only issue I would look at and say, you know what, lobbying's a little excessive in regards to our healthcare. But, yeah, that's something.
So we do agree on a need for some sort of regulation.
Oh, absolutely.
Free
So,
market.
but the
Right.
the only regulation I believe is for, I have it right here, a clear standard of care. That's it. And those clear standards of care can be made by the national government, and that's it.
Okay, I had a question. You guys keep demonizing the one-for-profit, claiming that this leads people into caring about money, not caring for other people. Now, I can talk about the virtue of profit in another section, but what I would ask is, what do you think the virtue of government is? If government really cared about helping people, our public school system would be vastly better. Maybe we wouldn't invade as many countries. Maybe the post office would work. Maybe the government website for healthcare would have worked. Politicians care about votes. They're the people that want to get in power. They don't necessarily. It's not like if the government owned healthcare, all of a sudden, healthcare would only be about helping patients. It would just be politicians trying to get votes by any means necessary.
We're not saying government is perfect in the state that it is. There are reforms on other sectors, such as in education, foreign policy, etc., that do need to be revamped. But we are striving towards those goals. But at this moment, we're also striving towards reforming the healthcare policies. And government does play a role because in our government, we're supposed to be ensuring individual freedoms, and life is one of those individual freedoms. You can't have any other right in this country if you don't have life. And life starts with healthcare and being able to continually live.
And on the nature of government, we believe in a government that is of the people, by the people, for the people. So if the people want, a universal healthcare system, a single care system, the government should be able to pass that through and make sure that happens. Again, it's the lobbying interests that continue to flood money to make sure that politicians win elections instead of listening to their constituents.
If the government accurately represents the people, then how come we've never had a woman president when women make up 51%?
But it doesn't. That's the point.
It
That's the
doesn't at
problem.
all.
Because the government right now it does not. We need a groundswell of grassroots movements to make sure that we get what we really need, which is the single payer system.
But if government is running something, inevitably, even if it starts out fantastic, which it may, when government runs something, they don't have an incentive to care about the people. They have an incentive for votes. Bureaucrats don't have an incentive to care about people either. However, if you're trying to make a profit, you do in fact have to produce an advantageous good or service in the market that people want. And we're saying if you get rid of a lot of these regulations and government interventions, the price will be so low that the government will have very few people left to help, which we are fully in favor of. People with
We've never seen that before, though. We haven't had a free market system that has had the same benefits as we've stated before. There's no free market system. We have a mixed economy right now, but even if we're looking toward mixed economy, they're double or triple that of any other country that's advanced. Like, the government needs to be in place because healthcare is a business, or it shouldn't be a business.
we actually have a few examples of that. One was in the U.S. itself. Before the government got heavily involved in healthcare, healthcare was actually very, very cheap and widely available. You can find that citation.
But wouldn't that be more because of the rise of medical costs and the passage of time and new technologies, rather than government being involved?
1 minute.
No, the government, the American Medical Association actually complained that the healthcare was too cheap, and so they lobbied to get licenses which monopolized their industry so that their wages would go up. Additionally, then you had Medicare and Medicaid, which subsidized healthcare, which drastically rose costs, even though the intention was to make it cheaper. It's actually less affordable now. The regulations on health insurance were meant to protect the consumer, but that's made health insurance more expensive too. The FDA was meant to protect the consumer from bad pills, and that's actually made pharmaceuticals 85% more expensive. All of the government interventions have distorted a market that was widely available, even for the most poor Americans, to something that's not available even for some middle-class Americans.
But Medicare, the cost of Medicare have risen because of the cost of medical devices and other things. If you look at Japan, which has a much larger elderly population than we do and a much smaller young population, which provides a tax base to pay for these programs, they've actually been dealing with it a lot better than we have. Their Medicare program is a lot more affordable. And also Medicare itself,
I'm sorry, but that's.
Happened to me last time.
Trying to be fast.
Let's take some questions.
when was, and this is for students, like, when was this time where things were in the 1960s? I just wanna, just a date, what time period are you talking about?
Oh yes, it was the like you said, mainly before the 1960s.
But hasn't prices of everything gone up since then?
Not
Food?
that much. It's gone up, cost of insurance is going up 800%.
I think costs of healthcare have gone up.
Yeah.
That's the important thing. We have to look at why the cost of healthcare gone up.
The cost of healthcare has increased by 1,200% since 1960, whereas the consumer price index is only 500%, so it's more than 50%.
That was 5 years right before
Or the double.
Medicare
The other thing
was
is,
passed.
everything in this country has gone up. We can look at tuition for colleges before 1960. It was
Also caused by
affordable
government.
then.
Well,
So
that's-
it's kind of like.
I would argue it's all about the
Well,
free
some private
market
schools-
rather than
private
the
schools
government.
some private schools are almost $80,000,
That's
it's
fair.
nothing to do with the government.
It does in fact. The college loan program, which is a subsidy for education, has made education far less affordable. This is a different issue. My father paid his way through Villanova Law School when he was actually below the poverty line because higher education used to be so cheap. Now it's not at all because the government wanted to help the poor. Now it's actually less likely for a poor person to get into college because of the government subsidy to help the poor. This is what we see with basically all government programs that want to help people. They have the opposite effect.
I would like to redirect it away from education.
Absolutely.
That can be another time.
My dad's in the back.
Does anybody have another question?
Another question?
Congratulations.
The Institute of Medicine of National Academies estimates that 18,000 Americans die each year because of lack of health insurance. The exact same source also says that 100,000 Americans die each year from malpractice in the health industry, which is 50% run by the government. So why are you focused on the uninsured and not the quality of insurance? Shouldn't we focus on a system that would promote innovation such as a free market, which would improve the quality of insurance while lowering the cost?
Well, if you look at malpractice, the reason why malpractice suits are so large, for example, say you hear something like a $50 million lawsuit, it's because that money is meant to take care of future medical costs. 75% is meant to take care of future medical costs. Under a single payer system, you wouldn't have to worry about future medical costs because it would be covered anyway, and you wouldn't have to worry.
So basically, it is reforming towards.
Right, and if you had tort
That's where
reform,
your tort reform comes
Well,
in.
I may be a misunderstanding. You say single payer system, nobody would have to worry about future medical costs, or was it?
It was
because of malpractice.
Oh, yeah.
Yeah.
And also, if you look at tort reform that was passed in Texas, I think it was in 2005, the date could be wrong, you see no real difference in both health outcomes and the cost. I think costs might have gone down by 0.1%. It's pretty much negligible. So tort reform isn't really the problem. The problem is the rising cost of healthcare and why things have gone so high.
I was going to say, I have actually found something pretty opposite. It was I think it was a research report. The Heritage Foundation found in 2003 was that they changed it. They looked at Texas and New York had very similar costs of healthcare. And then 10 years later, Texas, or no, you know what it was? The premiums did stay the same. You're right. It did stay about the same. What it was Texas doctors, there's now nearly double the amount of doctors, like per population in Texas than there are in New York. So tort reform does have a very strong effect. It increases the number of doctors, it will drive down price. So it does have an effect on price.
Well, again, that's because the doctors no longer have to worry about future costs and incredibly terrible lawsuits against them.
Yeah, definitely. That's definitely positive, and it's definitely the right way to go. And the amount of money doctors pay in tort reform is absurd. And it's really just the lawyers. I mean, the Republicans, we tried to fix it in '91 with the contract with America, and the Democrats shot it down. Not surprised that most trial lawyers are Democrats, and they make a lot of money off that. So.
Well, the problem is too, it all goes back to lobbies. This is something I think we both agree on, I hope. But they've made it virtually impossible to impose for the damages to be capped. We're looking for a cap. There are these insurmountable damages, and these judges that are being put on to award these damages are killing us. I have an uncle that just moved out of the state. He's an anesthesiologist because of the threat of malpractice. And he's not worried because he does a great job. He's got a long years of experience to prove it. But just because of the recent threat in this state alone, moved him out to Maryland. I don't know if that's any better. But.
All right, I'd like to move on to another question. Since it's already been talked about, a glance over, I understand that they provide a single payer system or a free market type reform. Either way, reform is going to happen. It needs to happen. Is essentially the point we've gotten to here. How are we in the United States going to pay for any type of reform at all?
Okay.
Well, the important start is really just reducing costs. Once you can reduce costs, obviously then insurance doesn't need to be as high. It's, but paying for it, as we all know, we're, deeply in debt, and we don't really seem to care. But I think we should really focus on eliminating the costs, and then, the government really won't have to subsidize as much as they are currently, because the insurance companies won't have to pay as much, and therefore we won't have to pay as much. So I think just bringing down the cost will really see payments for healthcare by the government become much smaller and almost negligible.
And a major piece to that is opening up to all states. If we're limited to the states, it's going to cause a problem. But if you open up that market to all states, it brings up competition, drives down prices. Makes it easier for everybody. It's a vicious cycle. It's not working.
Okay, well, the beauty of our system is that the government will have to spend no additional money whatsoever. It will actually save, I don't know how much they spend, so I shouldn't quote anything. They'll save a lot of money. Our plan drastically reduces medical costs in general, meaning we'll have to spend a lot less on whatever government programs they maintain to help those in need. Health insurance will be vastly cheaper. It'll save all of America a lot of money.
It'll be left up to the individual, it won't be left up to the government to take care of each person. Each person has